Hi friends, let's go over celiac disease. How about some interesting little myths and facts about celiac disease, what it is, what are the symptoms, and how it's diagnosed. I would say the thing that I've seen the most in the years that I've been a nurse is I have seen patients self-diagnose, or they diagnose their children with celiac disease when maybe what their child actually had was a gluten intolerance rather than the autoimmune disease called celiac. I'm quickly coming in here to let you know that my analytics show that a lot of people aren't subscribed. They are coming back to view, but they're not clicking that subscribe button. So please do me a favor. It's totally for free. Nobody's going to track you or come after you, but it really helps the algorithm. Otherwise, my channel is not being pushed out there for very many people. People aren't going to get all of this health information. But if you click subscribe and you come back and maybe you engage or click the thumbs up like button, that would be really helpful. I'll go into how it's diagnosed in just a moment, but let's just do some quick facts about celiac disease. Celiac disease is an autoimmune disorder. I know some people are uncomfortable with the word disease. We can say illness or it's something that some people are diagnosed with. When gluten is consumed, they end up having damage to their small intestines. So the symptoms of celiac disease are the following: bloating, nausea, vomiting, diarrhea, abdominal pain, brain fog, joint pain, tingling in the hands and feet, maybe even infertility issues. Those are just a few. Some people have chronic constipation or intermittent diarrhea with constipation. So they associate when they get those symptoms with eating anything with that gluten protein. Gluten is in pastas, crackers, breads, rye, not oatmeal, not pure oatmeal. The thing about celiac disease symptoms is that they do overlap with a lot of other illnesses, such as Crohn's disease, irritable bowel disease, irritable bowel syndrome, sensitivities, or even an allergy, say, to wheat, but not necessarily that it turns up that they have celiac disease. Let's quickly go over the long-term health effects. For those who are not diagnosed, or so they can't help protect their intestines by getting diagnosed, seeing a nutritionist, making sure that they have a GI specialist that they see, adhering to a gluten-free diet. If they don't know, they haven't been tested for it, they don't know they have celiac disease, time goes on that it is untreated and they continue to cause inflammation and damage to their small intestines, the following can occur: a greater risk of developing coronary artery disease and a greater risk of developing small bowel cancers. The treatment burden of celiac disease is comparable to end-stage renal disease, and the partner burden is comparable to caring for a partner with cancer. Untreated celiac disease can lead to the development of other autoimmune disorders such as type 1 diabetes, multiple sclerosis, and other conditions including dermatitis, anemia, osteoporosis, infertility and miscarriage, neurological conditions like seizures, migraines, short stature, heart disease, and intestinal cancers. Due to the nature of celiac disease causing difficulty in absorption of nutrition, vitamins, some children might be diagnosed with failure to thrive, or adults and children might have issues with lack of absorption or proper nutrition in general. Is gluten intolerance the same as celiac disease? No. And I did say that a little bit at the beginning, that is a really common thing. Because there's an intolerance to it and a lot of the overlapping symptoms are occurring, oftentimes people think, well, I've got it then, I've got celiac disease. But let's talk about how it's diagnosed. It's diagnosed by a good history and physical, labs, and a biopsy, the small intestine biopsy. Is gluten intolerance or celiac disease the same as lactose intolerance? No, those are three separate illnesses coming from three different issues. Again, the things that overlap with the bloating and abdominal pain and diarrhea, malabsorption, a lot of those things, again, can overlap. Those symptoms can overlap into other things that I mentioned, like irritable bowel disease, irritable bowel syndrome, glucose sensitivity, wheat allergy, Crohn's, etc. Many other things, lactose and fructose intolerance as well. But back to the main thing about Crohn's disease, and that is that the consumption of the gluten protein is what triggers the autoimmune response that causes damage to the intestines. That is what's happening to those people who have this illness. And it's easily diagnosed. Please don't feel like you have to suffer in silence. I'm also going to list some things below for support groups. And it's not easy if you're a child and you're diagnosed with something like celiac disease. However, there are support groups, there are pediatric GI doctors and dietitians that are out there to help you, children or adults. And there are so many products out now on the market everywhere that you go that can give you the same options, but for gluten-free choice. I hope this was helpful. And maybe you learned something new today. If you know anybody who has true celiac disease, or if you know somebody who has gluten sensitivity, pass along this information. There is a lot underneath. If you just open up description, lots of links to different things that might be helpful and educational for folks. I hope that you have a wonderful day. Thank you for stopping by. I'll see you at the next video.